Can a centuries-old herbal remedy offer a promising frontier in the fight against tuberculosis? As the world grapples with the ongoing health threat of this formidable disease, the potential of alternative and adjunctive therapies comes into sharp focus. Today, we delve into the intriguing relationship between tuberculosis and Korean ginseng, an ancient remedy revered for its diverse pharmacological properties. Tuberculosis, or TB as it's commonly known, is an infectious disease caused by the bacterium Mycobacterium tuberculosis. This relentless disease has been a persistent adversary for humanity, causing symptoms ranging from a consistent cough and chest pain to extreme fatigue. In severe cases, TB can cause significant lung damage and even spread throughout the body. The standard treatment approach for TB involves a lengthy regimen of antibiotics taken over the course of several months. However, this method presents its own set of challenges. These include the risk of drug toxicity, difficulties in treatment adherence, and the worrying emergence of drug-resistant strains of TB, particularly in areas with limited resources. Enter Korean ginseng, a time-honored remedy steeped in traditional Asian medicine. Known for its rich content of bioactive compounds called ginsenosides, Korean ginseng boasts several properties that make it a promising candidate for enhancing our defenses against infectious diseases like TB. These properties include immunomodulatory, anti-inflammatory, and antioxidant effects. Emerging studies suggest that Korean ginseng could have a positive impact on TB management through several mechanisms. Firstly, it can modulate immune responses, enhancing the activity of key immune cells like macrophages and T lymphocytes. By boosting the host's immune defense against the TB bacterium, Korean ginseng may help contain the infection and prevent the disease from progressing. Secondly, Korean ginseng holds potent anti-inflammatory properties. Chronic inflammation plays a key role in the pathogenesis of TB and the resulting tissue damage. By mitigating the inflammatory cascade triggered by TB infection, Korean ginseng may help reduce lung damage and promote tissue repair. Lastly, while Korean ginseng isn't a direct antimicrobial agent against the TB bacterium, its immunomodulatory effects may enhance the efficacy of conventional TB treatment. By augmenting the immune system and the activity of antibiotics, Korean ginseng could potentially shorten the duration of TB treatment and reduce the risk of drug resistance. Though research into the specific role of Korean ginseng in TB management is still in its early stages, preliminary studies have shown promising results. Ginsenosides extracted from Korean ginseng have demonstrated antimycobacterial activity against drug-resistant strains of the TB bacterium in laboratory settings. However, clinical trials are needed to validate the safety and efficacy of Korean ginseng in human subjects. In Korean culture, ginseng is revered as a symbol of vitality and longevity. Its medicinal properties have been emphasized in traditions spanning centuries. Now, as we grapple with the global health threat of tuberculosis, perhaps it's time to revisit the wisdom of the ancients and explore the potential of this time-honored remedy in the fight against this persistent disease.